When a teen female, often between the ages of 13 and 19, becomes pregnant, the condition is referred to as teenage pregnancy. It is a huge social issue having a far-reaching effects on the person affected and society at large. Although teenage pregnancy is more common in some nations, especially here in the Philippines, it is still a global issue. Teenage pregnancy carries several potential consequences. Firstly, it poses significant health risks for both the mother and the baby. Teenage mothers are more likely to experience complications during pregnancy and childbirth compared to older women. The infants born to teenage mothers are at a higher risk of low birth weight, premature birth, and development issues. Furthermore, it is important to create supportive environments where pregnant teenagers receive non-judgmental guidance, emotional support, and opportunities to continue their education. Community involvement plays a vital role in raising awareness, reducing stigma, and providing resources for teenage parents. There are several risk factors associated with teenage pregnancy. These factors can increase the likelihood of a young girl becoming pregnant during her teenage years. Here are some common risk factors. First, we have lack of comprehensive sex education. Insufficient knowledge about sexual health, contraception methods, and the consequences of unprotected sex can contribute to higher rates of teenage pregnancy. Then we have limited access to contraception. Difficulty in accessing or using contraceptives due to various reasons, such as financial constraints, lack of availability, or inadequate knowledge about contraceptive methods, can increase the risk of unintended pregnancy. Then we have socioeconomic factors. Teenage pregnancy is often more prevalent in economically disadvantaged communities where access to education, healthcare, and support systems may be limited. Poverty and lack of opportunities can influence a teenager's choices and increase the likelihood of early parenthood. Lastly, we have cultural and societal factors. Societal and cultural norms, including attitudes towards sex, contraceptions, and gender rules, can influence the risk of teenage pregnancy. Communities that have limited access to sexual health services and support systems may also contribute to higher rates of teenage pregnancy. Of teenage pregnancy includes 1. Health risks. Teenage mothers are at a higher risk of experiencing complications during pregnancy and childbirth compared to older women, as I've mentioned earlier. They have a higher likelihood of preterm birth, low birth weight babies, and pregnancy-related hypertensions. Teenagers may also face challenges in accessing adequate prenatal care, which can further impact their health and the health of their infants. Second, we have emotional and psychological impact. Teenage pregnancy can have a significant emotional and psychological impact on young girls. They may experience heightened stress, anxiety, depression, and feelings of isolation. The social stigma associated with teenage pregnancy can further exacerbate these emotional challenges, affecting their self-esteem and overall mental well-being. We also have financial strain. Teenage parents often face financial difficulties as they may lack the necessary resources and support systems to provide for their child. Lastly, we have child development and well-being. Children born to teenager mothers may face challenges in their development and well-being. They may have higher rates of health problems, developmental delays, and behavioral issues compared to children born to older mothers. The limited resources and parenting skills of teenage parents can impact the quality of care and support provided to their children. Preventing teenage pregnancy requires a comprehensive approach that involves education, access to healthcare, support systems, and community involvement. Here are some strategies and measures that can help prevent teenage pregnancy. Access to contraception. Ensure that teenagers have access to a range of affordable and confidential contraception methods. This includes providing information, resources, and services such as condoms, birth control pills, and long-acting reversible contraceptives like intrauterine devices or IUDs or implants. Efforts should be made to remove barriers such as cost, stigma, and limited availability. Youth-friendly healthcare services. Create youth-friendly healthcare services that are easily accessible and non-judgmental. This includes offering confidential reproductive health services, including contraception counseling, pregnancy testing, and STI testing and treatment. Providing healthcare professionals who are trained to address the specific needs and concerns of teenagers can encourage them to seek appropriate care. Comprehensive sex education. Implement comprehensive sex education programs in schools that provide accurate information about sexual health, contraception, and responsible sexual behavior. These programs should emphasize the importance of abstinence, but also include information about contraception methods and safe sex practices. Conclusion. Teenage pregnancy remains a complex and challenging issue with significant implications for individuals, families, and communities. It poses risks to the health, education, and overall well-being of young girls and their children. However, by understanding the underlying factors and implementing comprehensive strategies, we can make a positive impact. Creating supportive environments that offer non-judgmental guidance, emotional support, and opportunities for continued education is essential. Teenage mothers should be provided with the necessary resources to help them navigate the challenges they face and realize their potential. Lastly, by addressing the root causes of teenage pregnancy and implementing comprehensive approaches, we can strive to reduce its prevalence and minimize its negative consequences. Every young girl deserves the opportunity to grow, thrive, and fulfill her potential, and by working together, we can make a positive difference in their lives. And that would be all. Thank you.